So we're working to try to help keep you safe and healthy while you come to see your provider at our CHI health clinics. As you come into the clinic, just as we've been doing for quite some time now, you'll meet one of our greeters who will ask you some screening questions about your exposure risks and any symptoms you're having. One of the new things we've done is we're asking everybody in our clinics to be wearing a mask. If you're feeling healthy that day, we'll ask you to continue wearing the cloth face mask that we've all been asked to wear anytime we're out in public. If you're having symptoms of a cough or a sore throat or a fever or things like that, we'll ask you to switch that cloth face mask for one of our hospital grade surgical masks for an added layer of protection. Likewise, your healthcare team will be wearing masks as well, so we're all keeping each other safe. So our electronic check-in option, as you have the MyChart set up for your account, you'll get a notification 24 hours before your appointment, allowing you to check in through your MyChart, where you can update your information about your address and phone number and your insurance information. You can update your medical conditions and medications and all of that to speed up the check-in process and to keep you from having to do that with one of us and keeping you at a safe distance at home. So in addition to providing electronic check-in, when you do come in to check in person, we've decreased the amount of touching to be done. So you'll be asked to swipe your own credit card if you're going to use that to verify information. We don't need to take your ID card or your credit card from you just to decrease that touching. We've also been taking care of how we schedule your appointments. When possible, we're trying to schedule appointments for healthy people in the morning and for people that are having symptoms of illness in the afternoon to keep separated. Also, even within that, we have separate parts in our waiting area that healthy people will be in one waiting area and people that are having respiratory symptoms in another part of a waiting area, and minimizing the time that you'll be in the waiting area, trying to get you back into an exam room sooner to keep you separated from anybody else in our clinics. We've always been very careful about keeping our clinic spaces clean and germ-free, but we've increased the amount of that we're doing. Every hour we disinfect all of our surfaces, and we've reduced the amount of things in our spaces just to reduce, again, your exposure to other people's germs and to keep everything clean for all of us. When you call to schedule an appointment, you'll be given several options depending upon why you need to be seen and what symptoms you may or may not be having. Sometimes we do need to see you in the clinic, and you'll be invited to schedule an appointment to come in and see us. And again, we're making you safe to do that. But for the right purposes, we might consider offering you a virtual visit where you can visit with your provider via video chat or a telephone call to be able to take care of you and keep things separated. But we know we need to come in sometimes to see us, and we're doing things to make sure that that is a safe opportunity for you as well.